First of all, I would like to invite Professor Mowadat Hussain Rana, who is a consultant psychiatrist, who is honorary chair and professor of psychiatry and behavioral sciences at University of Health Sciences. He is member in the National Task Force on Mental Health, Government of Pakistan. He is the chairman of the Healing Triad, Pakistan, chief editor of Journal of Pakistan Psychiatric Society, honorary professor at Robert Gordon University, UK. A list goes on. He's consultant to World Health Organization, and he's visiting faculty and trainer for the National School of Policy Making and National Institute of Management. And he's now currently training, teaching, and treating patients around the globe. And I'm very honored to invite him on stage. Sir, please. You can sit.
Ladies and gentlemen, a huge thank you to the organizers for asking me to talk upon the very theme of this particular conference. And unfortunately, because of a little technical hitch, it will not be possible to share my slides with you. Nevertheless, I'll try my very best to highlight to you what my thoughts are on the issue of public mental health. The title of my talk, as you might have read in the program, is Public Mental Health, the Wandering Soul of Psychiatry. Now, what I'm clandestinely implying here is that if you decide to be a psychiatrist alone without a clear understanding or a dash of public mental health into your own soul as a psychiatrist, you are likely to wander around. And the soul will also wander around. And it is not very often in life that you would discover that soul that you lost. By the end of this particular conversation that I'm going to have with you, I will try and suggest, most humbly, idealistically, I must confess, those who know me for my sometimes romantic idealism of the concepts and themes that I propagate. If we had told somebody in 1990s that in Pakistan, they'll be the subject of behavioral sciences being taught at undergraduate level, he would have laughed his heart off, because there was no understanding of this particular subject, or even mention of this particular subject in the word of health, in the word of medicine. Lo and behold, thanks to visionaries like my teacher, Professor Malik Hussain Mubashir, late, bless his soul, we found behavioral sciences becoming part and parcel of MBBS curricula around the country. So some of these wild, very wild thoughts that I'm going to probably try and highlight to you today are maybe not a reality that may be realizable tomorrow or anytime sooner. But nevertheless, bear with me. Now, what do we have today in terms of psychiatry? We have, at best, treatment of symptoms. Let's be honest. We are sitting amongst, all the mental health professionals are here. That's what, at best, we do. And if you go around and look at any systematic analysis of our drug medication, you would know that at best 60 to 65% people improve with medication. But strange enough, 25% of people who are on placebos also improve. Would that be true for malignancies? Would that be true for enteric fever? Would that be true for malaria? Would that be true for diabetes, mellitus, or hypertension, or for that matter, coronary artery disease? No. So, how much excess advantage is it have for our patients if we just continue to do this phenomenon of treating our patients with medication alone? But then look at the whole current concept of public mental health, the soul, as I wanted to call it, of psychiatry. What promises does it fulfill? Now, when I started to look at public mental health, we used to hear about three themes: prevention of mental illness, promotion of mental health, and rehabilitation of mentally ill. These are the three themes. In fact, the flag bearers of public mental health would deliver at the end of their talks a method by which you could take what you were doing in your hospitals to the community. So it was individual treatment taken to the community, and there you gave that individual treatment to people closer to their grassroots. That's what public mental health was, or it is still. At best, what do we have to show to the world as mental health professionals? What do we do with public mental health? Well, we do days, walks, talks, etc., primarily focusing on three themes again: prevention of mental illness, prevention of suicide, and stigma. Is there anything more than this? Please do let me know if there are more themes that we pursue. Do we do anything more? No. Let us look at our own curriculum of psychiatry. It says in postgraduate training, forget about the undergraduate training part, that's pretty pathetic anyway. Let us look at the postgraduate part of our training in public mental health. Supposedly, for 3 months, each and every undergrad, postgrad in psychiatry has to go out and then tell to the College of Physicians and Surgeons that I did a medical camp in Azad Kashmir. We did a free medical camp in some remote district of where I'm training. And I attended or undertook general practitioners training. In what? How to prescribe antidepressants, as if they needed any to do that. This is what we have for public mental health. In postgraduate trainees, I see several number of postgraduates sitting here. Am I wrong? Or is it something more that you do in public mental health? This is what we do. Our flag bearer, of course, is our essential programs these days of opening helplines. The new fad. The new fad of public mental health is open helplines to people. But may I ask you who is sitting on the other side of the helpline? So here I am, I'm suicidal. Dial in. Hello. जी आप कहाँ से बोल रहे हैं? मैं हेल्पलाइन से बोल रही हूँ या बोल रहा हूँ. तो मेरा दिल कर रहा है कि मैं खुदकशी कर लूँ. अब परली तरफ जो बैठे हुए हैं कौन है? Have you thought about it? They are employees of an NGO, no offense, who were given training for 3 days, 4-day workshops on how to respond to psychiatric casualties. क्या एक्सपेक्ट करते हैं आप? परली तरफ से फिर क्या आवाज़ आनी चाहिए? अब साफ जाहिर है कि एक देखिए मैं अभी बिल्कुल एज पे खड़ा हूँ या खड़ी हूँ और यहाँ नीचे 100 फुट नीचे छलांग लगाने लगी. तो अब एक 3 दिन की ट्रेनिंग के साथ परली तरफ जो शख्स खड़ा है, आप इमेजिन करें, मैं अपने आप को इमेजिन करता हूँ उसकी जगह, वे तो हाथ पांव भूल जाएंगे. और पहली चीज़ जो आपके दिमाग से गायब होती है जिस वक्त आप अंडर स्ट्रेस होते हैं खुद, वो आपकी ट्रेनिंग होती है जो आपने 3 दिन में की हो, ऐसे गायब आती है। तो फिर परली तरफ से आवाज़ आएगी, खुदा के वास्ते आप ये ना कीजिए क्योंकि खुदकशी हराम होती है, आपको गुनाह होगा, आप सीधी जहन्नुम में जाएंगी अगर आपने खुदकशी की। तो भाई ये हेल्पलाइन के ऊपर तो सुनने की ज़रूरत नहीं, ये तो सुबह अम्मी जान ने भी कहा था, दोपहर को दादा ने भी यही कहा था, इसके लिए हेल्पलाइन पे जाने की क्या ज़रूरत है। देखिए मैं बहुत उदास रहता हूँ, मेरा दिल अक्सर करता रहता है कि मैं कुछ ना खाऊं ना पीऊं ना कुछ, तो परली तरफ से क्या आवाज़ आती है? देखिए खुश रहा करें, शाम को सैर किया करें। अगर आप शाम को सैर करें और खुश रहें तो बहुत सारी दफ़ा आपका डिप्रेशन ठीक होना शुरू हो जाता है। Can I have, now that I am available to you on the slides as well, can I change my slides? So this is what is going on. I was just trying to set the scene for you of what the public mental health is currently offering. Now you can read through, I would not say anything more, but can we now identify the real issue here after setting the stage for you? For me, the real issue is slightly off from here. Please, the next slide, please. This is the real issue. What do you see? Anybody? This is a thematic apperception test. This is a little TAT for you. Please, please, please go back. I didn't ask for the change. Please go back. Ji. Anybody?
Spring is coming.
Ji, spring is coming. That's a positive psychiatrist. Spring is coming. Or is it autumn arriving? Now let me not say what this is saying. Let me ask somebody that I'll have tremendous respect for and love very much from my adolescent years. Let him speak to tell you what this is. And this to me is the message that I wanted to give to all of you today. Please read. Please read. And read intensely. This last line, actually, ladies and gentlemen, are the psychiatrists who did not remove the stumbling stone on which those they had seen had fallen. This, ladies and gentlemen, is truly public mental health. To learn lessons from the patients, primarily to do what? Primarily to remove those stumbling stones that made them fall subsequently into schizophrenia, depression, anxiety, whatever you have. Those leaves that you saw were your patients. While you were the tree, those leaves did not turn yellow without your knowledge. In fact, they turned yellow in your own hands, and we couldn't do much about them. Now let us see what lessons can be drawn and how can we feed this tree differently that we have lesser number of those yellow leaves that you just saw? Well, this is imparting mental health. जब वो हेल्पलाइन पे कह रही थी कि आप खुश रहा करें, शाम को सैर किया करें, या जब आप ये किसी से कहते हैं कि देखिए आपके बच्चे को बीपीडी है, इसकी ट्रीटमेंट है डीबीटी, तो वो ये समझता है कि डीबीटी किसी खाद का नाम है, क्योंकि इस तरह के खादों के नाम होते हैं, डीबीटी, यूरिया वगैरह वगैरह। तो सोचता है कि मेरे बच्चा खाद खाएगा। फिर आपसे बताते हैं नहीं नहीं ये एक थेरेपी है, तो कहता है ये कौन करेगा? नहीं वो मुझे तो नहीं पता कौन करेगा, नहीं आप कर देना। मेरे पास असल में बिजी होता हूँ, मेरे पास थेरेपी का टाइम नहीं है। मैं उसको ये नहीं कहना चाहता कि मेरी ट्रेनिंग ही नहीं है डीबीटी में। देखिए ये आप जो मैं देखें सर, आप 6 महीने हो गए आपकी दवाई खाते हुए, आपकी डिप्रेशन तो ठीक ही नहीं हो रहा। वो असल में जी देखिए बेस्ट रिजल्ट आते हैं अगर आप एंटी डिप्रेशन को सीबीटी के साथ कंबाइन करें, तो फिर तो सर फिर सीबीटी शुरू कर दें। सीबीटी वो टाइम नहीं है मेरे पास असल में सीबीटी का, तो सर कुछ सीबीटी थेरेपिस्ट बता दें। भाई साइकोलॉजिस्ट के पास चले जाएं, वो करते हैं सीबीटी, और जो वो करते हैं सीबीटी वो रहने देते हैं इस बात को। इसलिए कि सीबीटी में और डीबीटी में आपको फॉर्मली ट्रेन होना पड़ता है। अगर आपने 1 साल अपनी जिंदगी का नहीं गाला हुआ और 2-2 साल आपने सुपरविजन नहीं कराई हुई अपनी, तो फिर जो आप सीबीटी करेंगे वो ये होगी कि देखिए आप पॉजिटिव रहा करें, अच्छा बोलें, अच्छा सोचें। जो आप सोचते हैं उससे आपका मूड डिटरमिन होता है। अगर आपने अच्छा ना सोचा तो आपका मूड खराब हो जाएगा। फिर मैं ये करूंगा, एंड बाय नो फॉल्ट ऑफ माइंड, बिकॉज आई नेवर गॉट द ट्रेनिंग। तो जनाब फिर ये इंपार्टिंग ऑफ मेंटल हेल्थ है क्या, और कौन करेगा? और प्रोटेक्शन ऑफ मेंटल। देखिए सारे लोग बीमार नहीं होते, 1%, 2%, 3%, हम पता नहीं क्या क्या फिगर्स WHO के कोट करते रहते हैं, पर जनरली लोग बीमार नहीं है भाई, कम से कम ऑफिशियली बीमार नहीं है, ऑफिशियली नहीं है बीमार सो फार। दे आर नॉट फुलफिलिंग ऑल द क्राइटेरिया ऑफ DSM-5R और वट एवर। सो उनकी मेंटल हेल्थ को, तो मुझे कुछ बग्स आपके सामने आइडेंटिफाई करने हैं जिनके न्यूरोट्रांसमीटर्स तो नहीं है, बट इन माय humble opinion, our society will stumble with serious psychiatric disorders if they do not address these issues hand in hand with mental health specialists. When the policies are going to be made by ignorant politicians, when you and I will not generate evidence for them through our researches on which they make their policies, based on when universities are only producing postgraduates who are not, universities are not producing data for the policy makers to develop policies that are best for the people that they are supposed to serve. तो फिर आप वर्ल्ड बैंक को ना कहिएगा कि उनकी पॉलिसीज यहां क्यों आ रही हैं, क्योंकि आपकी अपनी पॉलिसीज तो कट एंड पेस्ट है, आपने उनको डेटा ही नहीं दिया, क्या करें वो पॉलिटिशियंस। सो यू वुड हैव टू आइडेंटिफाई टू देम दैट व्हेन देयर विल बी मिसोजिनी, व्हेन देयर विल बी इंटॉलरेंस, देन द मार्जिनलाइज्ड, those who are different, they will go and commit suicide. When there'll be intolerance in the society, then there will be hundreds of people who will drag somebody all the way up to the 8th floor and throw him down. And then they would not stop there, they would set that body on fire. Because somewhere along the road, something had happened, and I'll point that out, because of the bigotry. that children are being brought up in bubbles created by their parents. ना बेटा ना ना, तुम्हारा काम सिर्फ पढ़ना है, तुमने कुछ और नहीं करना, तुम्हारा काम बिल्कुल, अच्छा देखो ऐसा करो, तुम्हारे आजकल इम्तिहान हो रहे हैं, तुम पढ़ो, मैं तुम्हें खाना खिलाती हूं, ये ए लेवल में है कमबख्त। अम्मी मैंने जाना है, मुझे देर हो रही है, मैं उतनी देर पढ़ रहा हूं, जरा तस्मा बांध देना। अम्मी फटाफट आके भाग के तस्मा बांध रही। यार अब इस लड़के को जिससे आप लेके जाएंगे जिंदगी के धारे में, what performance is he going to give? So that fragility that we are inculcating in our next generation probably is more harmful than adverse childhood experiences that we often talk about in pathology. So everything is going to become adverse childhood experience for this fragile. उन्होंने मुझे घूर के देखा, हाय अल्लाह, दादा अब्बू जो थे ना, उन्होंने मुझे कहा कि इधर आके ना मुझसे पप्पी लो। तौबा तौबा, इसका मतलब है कि ही इज ए प्रोबेबली ए पीडोफाइल। कहां गए यार आप, किधर कहां रह रहे हैं? बिकॉज यू हैड हर्ड अबाउट ऑल दिस क्रैप। आई एम सॉरी, थैंक यू वेरी मच फॉर पॉइंटिंग आउट दैट सर अर्लियर। एक कल्चर की बातें जब आप दूसरे कल्चर के अंदर उसी तरह से प्लांट कर देंगे लाके, तो यार सारे दादे पाकिस्तान के पीडोफाइल हैं जो अपनी पोती के माथे के ऊपर बोसा लेना चाहते हैं। आपकी आज की हर मां 10 दफा देखती है, जिस वक्त उसका चचा कहता है बेटा जरा इधर आओ, मुझे गले तो मिलो, वो कहती है गले मिलने के लिए क्या? डोंट टेल मी दैट यू आर नॉट सीइंग ऑल दिस. दिस इज द डिग्री ऑफ फ्रेजिलिटी with which you are bringing up your children. They don't need any adverse childhood experiences anymore after this fragility that you are inculcating in them. कोई मुश्किल काम आप उनको नहीं देते. गली में वो नहीं खेल सकते, साइकिल पे वो नहीं कहीं जा सकते, बस पर उनको जाना जहर लगता है, टांगे घोड़े रेड़े अब होते ही नहीं है, घुड़सवारी का कोई तस्वीर नहीं है. So what are they doing basically? They're living and thriving on this. क्योंकि अम्मी को अगर खाना भी बनाना होता है तो इमीडिएटली इसके ऊपर एक गाना लगा के उसके लिए छोड़ जाती है. So this child who's 6 months old, when he's going to be brought up on this screen, what do you expect him to be then subsequently? And what kind of challenges are going to be there for this person? This person is going to become socially isolated. And you would have to review the entire concept of social isolation in psychiatry after you have brought up children on this alone. When nothing is going to excite them anymore, when their threshold of excitement is going to hit the roof and everything is going to be boring for them. Go and talk to these children in the schools and colleges. बेटा आप क्यों ड्रग्स ले रहे हो? मैं बहुत बोर हो जाता हूं तो मुझे कुछ समझ ही नहीं आती, और मैं एक दफा जरा करता हूं तो उसके बाद बोर्डम खत्म हो जाता है, हर चीज हरी हरी लगनी शुरू हो जाती है, हर सब कुछ हसीन हो जाता है. I need more stimulation, God damn it. This is what's going on, sir. What's the way forward? Most humbly submitted, with all the apologies that I had rendered earlier of my idealism, you would have to create paradigm shifts. This has to become the future. Otherwise, you will not be able to deal with the challenges of the future children of this country. These are the paradigm shifts. But are these shifts anyway presented in any curricula, undergraduate or postgraduate? I'm afraid the answer is a very big no. So, this is what I think the way forward. To get out of the word of prevention of mental illness, promotion of mental health, and let public mental health adopt today the concept of well-being. A lot of countries are working on it. There are several countries who have actually developed ministries of well-being and happiness, including our very good neighbors, UAE. ministries of happiness and well-being, far ahead of us. But then what is well-being? Just to take a couple of more minutes of you to highlight to you this concept, if you're already not. So it says, health may be wealth, and mental health may also be the wealth of health. But if you are unhappy and you are healthy, you're no good. तो फिर आप सर्दियों की शामों का इंतजार नहीं करेंगे उदास फिरने के लिए, आप गर्मियों में भी उदास फिरेंगे. Happiness, joy, smile, laughters, bliss, this is missing. इधर इधर से हंसने को हंसना नहीं कहते. This is the promise. This is the promise. And when I say productivity, it means less reproductivity. Because currently, reproductivity is the only happiness in certain parts of Pakistan. पता नहीं डॉक्टर भुट्टा यहाँ तशरीफ रखते हैं या नहीं, बैठे हो तो हाथ खड़ा कर देंगे अगर हैं तो. अगर नहीं है तो मैं उनका कोट आपको सुना देता हूँ. वो मुजफ्फरगढ़ में काम करते हैं, डॉक्टर भुट्टा. कहीं हो तो मेरी तरफ से उनको सलाम पेश कीजिएगा. उन्होंने मुझे कहा कि मैं उनसे पूछता हूँ, बीबी तू बोला ये ते दसा मेरे को कि तू डिप्रेशन तो नहीं गई कदी? कहती बोला डिप्रेशन की होंदा सही? मेरा मतलब है कि उदास तो नहीं थी वेंदी किसी वेले. ये उदासी की होंदी है सही? असी तो उंज ही उदास हाँ. हाँ ये मैं दसा सकनी है ताकू कि मैं खुश कदों होनी हाँ. बोला उदों होनी है जिस वेले कोई हाड़ी सोनी ते फसल चंगी थी वेंदी है. जदों कदी कदी घारी च कोई पैसे दे जांदा है, कदी जिसले घर बच्चे की पैदाइश हो जाती है. बोला महीना 2 महीने 2 महीने मेरे को जाके फिर फसलों कम नहीं करना पैंदा, मैनू पट्ठे नहीं वड्डने पैंदे सही. तो 2 महीने चंगे गुजर जाते हैं, थोड़े खुश गुजर जाते हैं. बोला ये चीज़ की गल नहीं करेंदे पे तुसी. So it's denial of sadness that is bringing happiness to people. Sad. The idea of citizenship. What is a citizen? Citizen is somebody who is interested in the well-being of the other person living on the other side of the street rather than his, and then sets up a motion in which his neighbor is in charge of his happiness and joy. This is citizenship. This is Riyasat-e-Madina. जहां जो मुहाजिर था वो इंचार्ज था उनकी हैप्पीनेस का जो मदीने के रहने वाले थे, और मदीने वाले इंचार्ज थे उसकी हैप्पीनेस के जो हिजरत करके आए थे. इसको सिटीजनशिप कहते हैं, इसको शहरियत कहते हैं. ये कहाँ है आपके करिकुलम? और फिर रेजिलियंस आती है. और मैं यहाँ कुछ इंटरवेंशंस भी सजेस्ट कर रहा हूँ आपके सामने. प्लीज स्टॉप हेटिंग सोशल मीडिया एंड इंटरनेट. इफ यू डू नॉट नो हाउ टू यूज अ नाइफ, इट डजंट मेक द नाइफ रॉन्ग. आप उस नाइफ से क्या काटते हैं तो आपकी मर्जी है ना. आप कलाई काटते हैं, आप गला काटते हैं, या आप केक काटते हैं, या आप सब्जी काटते हैं, आपकी मर्जी है. सो प्लीज try to understand that internet is here, social media is here, they are here to stay. We have to turn it into our strength. Stop cursing it. There's no point of it. Nobody's even listening to you if you're cursing it. Well-being curriculum. Skilled parenting. Dr. Zishan is here, he's very kind. We are trying to assist him to develop a book on parenting for all of us, because I think that's the need of the hour. We need to prepare tomorrow's parents into bringing in children who are different than you and I, and value-based citizenship. Ladies and gentlemen, tomorrow's public mental health is about vaccines of tolerance, vaccines of patience, because eventually it will not take steroids to drive away COVID-19. It will take vaccines. I hope you can develop vaccines. Thank you very much.